Coronavirus pandemic has been one of the major challenges ravaging the world, which has led to deaths globally. The discovering of the vaccines came as a sigh of relief to world leaders as they made frantic efforts to get people vaccinated to curb the spread of the deadly disease. Since the outbreak of the pandemic in Nigeria in February the 27th, 2020, the federal government is not resting on its oars to get the vaccines to all the states in the country to enable citizens to take the vaccines. The Townhall meeting holding in Edo State on COVID-19 vaccination in Nigeria, organized by the Presidential Steering Committee on COVID-19 in partnership with the National Primary Healthcare Development Agency, is to ensure that leaders in the South-South zone enlighten the people to get vaccinated.
The global vaccine target set by WHO are for all countries, and here all states, to fully vaccinate at least 10% of the population by end of September, and 40% of the population by end of December, and another 70% by mid-year next year.
It is not enough to offer vaccines to Nigerians, but that we must also empower the people with the correct information they require to make informed decisions about getting vaccinated against COVID-19.
If 70% of us are vaccinated, we'll have a herd immunity that will assist us in reducing the spread of infection to our general public. We'll reduce those who have acquired the infection to get severe diseases.
In his remarks, the Minister of Health, Dr. Osarogiuwa, said the daily emerging figures on the disease gives cause for concern. He emphasized the need for Nigerians to support the federal government's efforts to enlighten citizens to get vaccinated. He said all the approved vaccines by the federal government is available in Nigeria and they are safe and effective.
This dangerous virus lurks around our country, and it is up to us to rise up as a collective responsibility to protect the lives of our citizens and also their livelihoods against the virus, and to mitigate its destructive impact on our national economy.
The governor of Edo State, Mr. Godwin Obaseki, represented by his chief of staff, Osarogiuwa, said his administration has put measures in place to prevent the spread of COVID-19 and has also taken steps to sensitize the public on the vaccines.
And in the course of dealing with the pandemic, we were afforded the rare opportunity of recalibrating the state's healthcare system. We set to work to revamp and equip isolation centers, laboratories, and offices to attend to the peculiarities of the pandemic.
Patience Osarogiuwa reporting.